Hi, everybody. Thank you for joining me for today's Lunch and Learn. Like Carol said, my name's Gabby, one of the nurse practitioners here at Joy Wellness Partners. Let me just share my screen so I can start talking about a topic that affects most men at some point in their life. That's going to be hair loss. Let's see. Yeah, whether you've just started noticing some thinning in the crown area back here, maybe a little bit of a receding hairline, or you've been dealing with it for years, we have many regenerative solutions here at JWP. So we'll walk through different causes of hair loss, different regenerative therapies like PRP, ExoPlus, or peptides, which can be helpful. We'll talk about who's a good candidate, and then we'll also go through some specials that are going to be going on next month. So let's dive on in. I wanted to start off with a good statistic just to showcase how prevalent hair thinning truly is. So men can start noticing hair thinning in as early as their 20s. And then 85% of men experience hair thinning by the age of 50. So this is something that's probably more prevalent than what we think, and it can definitely impact overall confidence and the quality of life as well. So what's actually happening beneath the surface when we're talking about hair thinning? A shortened growth phase. So essentially, all our hair stages go through this anagen phase here, which is the growing phase, and this telogen phase, which is the resting phase. What we start to notice is that we get shortening of this growth phase and elongation of this resting phase. So what that means is hair grows slower and it's starting to fall out soon as well. Alongside that, those follicles are also shrinking. So they're physically shrinking in diameter and depth. So when you are noticing any of that hair growth, continue, it's finer and thinner hairs. And then alongside that, as those follicles are now shrunken, they require less metabolic support. So naturally, the body's going to give them less blood flow, meaning less oxygen and fewer nutrients, which is going to impact those hair follicles and just the overall scalp tissue quality as well. Over time, sorry, I don't know what happened there. There we go. Over time, those follicles eventually become dormant. So when they become dormant, I kind of say that they're in like a sleeping mode. Eventually, as they're continuing in that phase, they eventually will die off. And that's when you have no hair that's produced at all, which is when you'll notice some of those bald spots that don't even grow any of that fine, thin hair anymore. So causes of hair thinning, androgenic alopecia, this is what is mainly classified as male pattern baldness. It has a combination of genetics and hormones, specifically DHT, which is a metabolite of testosterone, nutrient deficiencies, chronic stress or inflammation, and uncontrolled health conditions. So we'll go through these one by one. The most common number one cause is androgenic alopecia, so that male pattern baldness. It's a genetic component that contributes to the follicle shrinking, and then you're also getting a decrease in that blood supply to the follicles as well. So DHT is that hormonal trigger. That's a testosterone metabolite. There are some people that have a genetic sensitivity to where if they have any level of DHT, it's going to bind to those receptors in the hair follicles, and that's what causes that shrinking of the follicles over time. That exposure to the DHT also can lead to a decrease in that vascular endothelial growth factor, which is the growth factor that gives that signal to make new blood vessels. So you have the genetic component alongside the genetic sensitivity with the DHT that's causing those follicles to shrink and causing less blood flow to the follicles and the scalp itself as well. Then we have nutrient deficiencies. So protein, all of our hair is made out of keratin, which is a protein. And so without adequate protein intake, the essential amino acids, your body can't support optimal hair growth. Biotin, which biotin supports that keratin production. Zinc, vitamin D, vitamin B12, essential fatty acids, and iron to make sure that you're getting enough oxygen as well. We have some other things like oxidative stressors. So stressors are going to be anything going on in the body that could be chronic stress, whether that's psychological, whether that's physical stress, alcohol consumption, hair products, especially ones that contain parabens, sulfates, overall air pollution. So we're living in an environment that does cause a lot of oxidative stress to our scalp, to the hair follicles, smoking, and there's plenty of other oxidative stressors that can be impacting our hair. Uncontrolled medical conditions, so thyroid conditions, uncontrolled diabetes, gut dysfunction can also impact our hair follicles as well. And then autoimmune conditions and inflammatory diseases, because they can wreak havoc kind of all over our body, including our scalp as well. So looking at all of these are just different things that could be contributing to hair loss. Like I said, the most common one tends to be that androgenic alopecia. And so if you are starting to notice that hair thinning, when is the right time to start hair restoration? I always say the sooner the better. So where you first start to notice it is going to be a receding hairline, so recession in those temples, and then thinning in this crown area back here in the vertex. Early intervention is going to give you better outcomes because hair thinning is progressive. And so you want to preserve that existing hair that's there, stimulate growth in those hair follicles that are starting to get weaker to prevent further thinning, and then to also prevent bald spots. So once those hair follicles are weak and they're thin enough, they eventually become dormant. Like I said, they're sleeping and they'll eventually die off. Once you've reached that dormant stage, it's not impossible to wake them up, but it's much harder. And so you want to get started as soon as you're starting to notice any sort of thinning going on to help prevent it before we're trying to kind of wake those follicles back up. Now, one of the things I do hear people say is that they're just going to wait until they get a hair transplant. And they're like, well, it's thinning. I'm just going to let it continue thinning, and then I'll eventually get a hair transplant. If you talk to plastic surgeons that do hair transplants, or anybody that does hair transplants, you'll hear them say that you, regardless of if you want a hair transplant, you want to support the scalp before and after the transplant. So it would be like if you were trying to plant flowers, but you didn't have good soil. So you want to have good soil and then maintain those and maintain the soil quality after the plants are, or the flowers are plotted as well. So that's how I explain it. Get started sooner, better outcomes, and hair growth is like watching paint dry. So you want to get started on it earlier to help preserve those hair follicles. Now, the only current FDA-approved treatments for hair loss that are most commonly talked about are going to be oral finasteride and topical minoxidil, or Rogan, as most people know, can like or know what it's called. Oral finasteride will block the 5-alpha reductase to reduce DHT, which, if you remember, DHT binding to the hair follicles is what causes that thinning in people that have that genetic susceptibility. However, one of the downsides with oral finasteride is it can cause some sexual side effects like low libido, erectile dysfunction, and potentially some mood changes as well. So we get plenty of clients that don't really want to mess with changing that pathway with oral finasteride. The other option is topical minoxidil. It works by increasing blood flow to the scalp area and prolonging that growth phase for the hair follicles. It can stimulate new hair growth. Honestly, it can be pretty effective, but daily application is required. And so the consistency with it can be hard to follow. And it can give you like a small percentage of improvement. Once your hair has gotten to a level of being fairly thin, I always recommend adding in other modalities to help with that hair thinning though. And then one of the downsides is you do tend to notice that hair does start to shed once you stop using minoxidil. So hair restoration at Joy Wellness Partners, we utilize various different modalities. So just kind of starting off, everybody gets a medical evaluation. We want to see if we can determine the root cause of what's causing your hair thinning. So we go through medical history, family history, lifestyle factors. Some people choose to get labs as well just to assess their thyroid function, hormone levels, and vitamin levels. So that's a good starting point for the majority of our clients. Following that, we do offer Nutrafol, which is a supplement. It has different things in it that are going to help support some of those like potential causes that we talked about. So some micronutrients like zinc, selenium, and biotin. It has some adaptogens like ashwagandha to help support the body's cortisol response. And then some botanicals like saw palmetto to help reduce that DHT binding to the hair follicles without something as aggressive as that oral finasteride. So this tends to be a pretty good starting point as well. And then the biggest, most common treatment that we do here is going to be this platelet-rich plasma. We're going to go into this much further in detail, but it's basically plasma from your own blood. It's full of growth factors. And then alongside that, this is our main therapy. A lot of times we will add on exotherapy or peptides just to help further augment the effects of the platelet-rich plasma as well. Well, like I said, we'll dive in deeper to some of these. So just starting off, platelet-rich plasma, it's your own body's natural solution. So it's your own blood. It's full of growth factors, which are signalers. So some people ask, like, what are these growth factors? Platelets are full of a lot of them, but some of these are platelet-derived growth factor, the vascular endothelial growth factor, which basically enhances blood flow to those hair follicles by promoting formation of new capillaries. Fibroblastic growth factor, insulin-like growth factor, interleukin receptor antagonist, which is an anti-inflammatory cytokine, so it can help calm down like that inflammatory damage to the hair follicles. But when it's injected into the scalp, these growth factors can stimulate those dormant, sleepy hair follicles. It can extend the growth phase of your hair cycle. So instead of having a shortened growth cycle phase, it's going to extend that so your hair is actually able to grow back to be a little bit thicker. It's going to increase the blood supply to the hair follicles and to the scalp, decrease inflammation to the scalp tissue, and then also promote collagen to help strengthen the scalp environment. So what does this consist of when we're talking about PRP? It's a pretty quick treatment. You come in for about 45 minutes or so. We will do an in-office blood draw. Then that blood is put into a centrifuge where it's spun at a pretty high speed, and then it separates. So that liquid gold, what I call it, is the PRP that's going to be used and re-injected back into the scalp. So we take it and we inject it into areas of where we notice some of that thinning. We do use ice and vibration to give you comfort. I know a lot of people tend to be worried about that, but we have many different comfort measures for that. And the injection process itself only takes a few minutes. So it tends to be very well tolerated for most people. And then post-treatment care, the nice thing is that there's typically very minimal downtime. Most patients will resume, they'll go back to work, they come in during their lunch, whatever it may be. You may have some mild tenderness for a day or two and then have like a feeling of pressure on the scalp, but otherwise, they're pretty minimal downtime. We usually say avoid harsh hair products, things like, shampoos that have a lot of paraben sulfates for the next few days and kind of long-term from there as well. And then, like I mentioned, that mild pressure sensation may also be experienced and it doesn't last for too long. So overall, pretty quick, very minimal downtime. I get the question of, is this a one and done treatment? It is not. So we do have a PRP restoration protocol. You want to do the initial series and then the maintenance series. So the initial series are going to be 3 to 4 treatments, usually about 4 weeks apart. The purpose of that is to stimulate the hair follicles consistently during different growth cycle phases. And we want those regenerative effects to compound. We want to reinforce the delivery of those growth factors. And then there's maintenance. So one session every 3 to 6 months, and that's going to vary. It's going to depend on, how you responded initially to the PRP, the degree of hair thinning that you started with, and then if there's any ongoing use of supportive treatments. So did you add exosomes? Are you using peptides? or the ExoPlus? Are you using peptides? You know, are you, did we address any of the other medical conditions that came alongside with that? But yeah, the initial and then the maintenance. So you want to help resoil the areas, get those plants to grow again. And then the maintenance is kind of like adding fertilizer from there on. Hair does take time to grow. It's a slow biological process. And so you want to give it some time, but then also using a multimodality approach is going to get you the best results. Similarly to teeth, right? If we want good oral health, you brush, you floss, you see a dentist, you may whiten your teeth, whatever it may be. So multimodality approach. Now, PRP tends to be our standard for hair restoration, but we do have a couple of additional regenerative therapies that you can add on to the PRP to get even more intense results. So one of those are going to be ExoPlus. This is the advanced regeneration to add on to your hair restoration process. So exotherapy is a bunch of master communicators. They're tiny vesicles that are released from cells. All of our hair follicles are a clump of different cells that make things like keratin, which is the protein that makes the hair follicles, and melanin, which we need for the pigment. They are powerful signaling molecules. So eventually over time, with age, disease processes, whatever it may be, our cells don't communicate as well with each other. And so adding in these signaling molecules can help your cells learn how to communicate better and start to stimulate that regeneration. So inside of these ExoPlus molecules, there's some of those growth factors that we talked about with the PRP. There's some of those cytokines that help with that immune modulation and decreasing that inflammatory response. And then also some different proteins that can help with, or different microRNAs and messenger RNAs that can help with the direct protein synthesis and gene expression as well. It can kind of help, you know, turn on or off some of the inflammatory pathways. And then it also gives instructions for building the essential proteins that we need for our hair as well. Now, like I said, it can be combined with PRP for some of that maximal regenerative impact. It can be injected directly in with the PRP. And then peptides. So there's a lot of different peptides out there. I kind of explain them as like different tinker toys. So depending on how they're put together, that's going to dictate how that peptide works and what it's working for. One of our popular ones is this GHK-Cu peptide. It's a copper binding peptide. And so it can be topically applied or injected into subcutaneous tissue. Most of our clients typically will apply it topically if they're looking for that hair restoration, but it further encourages hair follicle activity, enhances angiogenesis, so that's going to be the formation of those new blood vessels. And it acts as an antioxidant for the hair follicles as well. Copper is a substrate needed for collagen and elastin. So when we have that, you're also improving the scalp tissue and just overall scalp health. It's a very valuable tool in early intervention, but then also for ongoing hair restoration maintenance. So many times this GHK-Cu peptide is utilized for that ongoing maintenance. So after you've had your PRP sessions and you're kind of in between that initial and those maintenance sessions, that's where a lot of clients will apply that topically to have that maintenance set in before they do their maintenance PRP. So it's just a nice adjunct during those intervals. So confidence starts at the root. At JWP, we are here to support more than just your hair. We're here to support you. We offer a lot of different regenerative therapies to help. Like I said, whether you're just starting to notice some of those changes happening, or you've already been on this hair restoration journey and you want something with more, science-backed solutions or something a little bit more regenerative based, we're here to help you feel. But thank you everyone for hopping onto this quick lunch and learn. I hope you got some valuable insight on how to approach hair thing. And then, reach out to us if you have any other questions.